Here at secondstreet.org, we're hearing lots of stories from Canadians who go abroad for their medical needs. I'm very pleased today to be speaking directly about this. I'd like to introduce you to both Christy and Leanna. Ladies, thank you so much for joining us.
Thank you for having us, Chris.
Yes, thank you. Yes.
I don't know who'd like to take the first run at this, but if one of you could please explain to us how it is you got your start and really tell us what it is your organization does.
Sure, I can start, if that's okay with you. So before we started our business, we were friends and we both experienced United States healthcare. Christy lived there and I lived there before. At the time we decided to start our business, we both lived in Halifax, Nova Scotia in Canada. And we both experienced medical delays or inability of a doctor to give us an answer. And it happened to both Christy and I. And so we didn't know why it's happening. For example, I got a 6 months wait for an ultrasound, which is such a simple procedure, but the wait was close to 6 months. Christy had some issues with her children that she wasn't able to find an answer. So she ended up taking her kids to the United States. But it was sort of a second kind of like a feeling for us, okay, well, what do the people do in the United States? Although if not for all Canadians, the answer may be that simple.
Mm-hmm.
It's clear that you can go across the board. However, it's not clear how it's all done, what's involved, how much does it cost? Is it safe? Who do I go see? So all these logistical things that seem to be sort of secondhand here to all the Canadians, because our healthcare, we just go to the doctor, we get the referral, and it's pretty clear cut. When you cross the border, all these issues may arise and you may not find the answer right away. You may spend time doing it. So we kind of tossed the idea around, well, what if we help people to take, and we'll take care of that logistical, we'll take care of the logistical part of the business, and they can come to us and they can focus exclusively on getting better, and we will take care of all the details, because all these details require dedication, they require strengths, they require mental clarity as well, because when you're in pain, and I don't know, if, I've been in pain before, and sometimes the judgment is clouded. You don't know what kind of information you're getting, what kind of questions you need to ask. So we thought a little bit more and we did a little bit of research. We ended up going to Medical Tourism Association Congress that was happening in Washington, D.C. a couple of years ago. And we thought that there's a market. We've looked at Fraser Institute that provides numbers of Canadians that leave every year for care elsewhere. So the numbers were pretty high compared to Canadian population. And assuming the fact that everybody's getting free healthcare, there were millions of people that were leaving Canada to get healthcare somewhere else. So this is how we sort of started our company. You know, it definitely helped that we both had that problem. It helped that we had both experienced both sides of the healthcare. Christy also has over 14 years of experience working for insurance company and doing medical evaluations for insurance companies. So we combined our skills, and that's how we started.
That's really fascinating. I think the fact that you've both had experience either working alongside of or working in the American healthcare system, and then experience the Canadian version of the healthcare system while living up here, has probably really enabled you to get this thing up and running. Christy, if I can ask you, it was mentioned that this involved your child. Can you tell us a little bit more about that? Would you mind sharing a bit more of that story? What was it that was happening, if you can share that? And what sort of treatment did you eventually get in the United States?
Yeah, so my son was around 6 months old, and he was perfectly healthy, perfectly normal, healthy. And all of a sudden, he started dropping weight, and I could not figure out why. He then started refusing to eat. I did not have a family doctor at the time, and there was no one taking new patients in Halifax. My only option basically was to go to a walk-in clinic. And it was, you know, incredibly frustrating, because here I have this baby that, you know, can't talk, you know, he can't tell me what's wrong. And, you know, he was not growing, he was not eating. And a friend of mine ended up kind of taking and asked her longtime family physician if she would take our family on. And so she agreed to, and I had to get a referral out to a pediatrician, which took quite some time to get. And I really didn't get much help there. And this kind of went on for about 6 months. And by this time, he was failure to thrive. So he went from being in like the 50th percentile, normal, healthy, to being completely off the growth chart. Like,
Oh
that's how
my.
much weight he was. And he would go days, you know, like 2-3 days where I could not get him to even eat like a full bottle. And it was just, you know, so distressing
Oh,
as
of
a
course.
parent. And, you know, I couldn't figure out, you know, what was going on. And so I ended up making an appointment at a pediatrician's office in Charlotte, North Carolina, which is where I had lived before. And so I, you know, flew there, and, you know, the very next day we were into a pediatric GI doctor, and she diagnosed him right on the spot. He had reflux. Very simple, something very easily treatable. You know, a lot of times babies that have reflux, it will come out. His was more internal, so you couldn't see it. But that was never, you know, I guess, an option, or I don't know, like there weren't really any tests. I wasn't really getting anywhere with the doctor in Halifax to run more tests to find out, okay, what could be causing this? And, you know, and they were able to, you know, figure it out and put him on some medication. And, you know, and once he started taking that, after a couple weeks, he started eating again. And it did take a little while for him to catch up,
Mm-hmm.
you know, and he's perfectly healthy now. He's a
Well, good.
happy, healthy boy. And, you know, but it's, you know, as a parent, it's frustrating not being able to get the care that I wanted, and, you know, not to have somebody take it another step further, you know, to address the concerns. And, you know, so it's just one of those things, you know, as a parent, or, you know, mama bear, you
Mm-hmm.
know,
Of
you want
course.
what's best for you, have that, and do what you can. So that's kind of, yeah, you know, my situation with my son. But,
So it's interesting. So here you waited around, if I can tell with what you were saying, around 6 months to get some adequate
mhm,
care or some sort of good response or a solution to your problem in Canada.
mhm.
You flew to the States and it was dealt with in about 24 or 36 hours?
Yeah. We were in the pediatric GI doctor the next day.
Wow.
Yeah.
Wow. And it's for something
Yeah.
as what is thankfully as commonly treatable as reflux. That's just
Yeah.
amazing. And so to your point,
Yeah.
I'm not sure who'd want to field this question to that point. What sort of ailments or problems or reasons do Canadians have for going abroad for healthcare? We know they go abroad. We just don't know why. We have next to no data explaining why and what kind of treatments Canadians are seeking abroad. Can you guys paint us a picture there?
Um, I think the reasons for going abroad are numerous. It's not just this one reason why. Obviously, as Canadians, we're proud of our healthcare, and you know, essentially nobody wants to pay extra for something that we already pay through our taxes.
Mm-hmm.
So when people come to us, there could be a couple of things that are going on. Long wait lists is one of the reasons they contact us. We've had clients that said their surgery will take up to 2 years. And people were unwilling to wait that long to get better. We've had clients that were unsure what's happening with them. They had tried every single avenue that they knew, and they still were not getting anywhere. So those are the clients that are just stuck and they don't know what to do. Getting a second opinion here it's possible, but it's a lot harder than in the United States,
Mm.
where you can simply switch to a different doctor and go see a different doctor. Here you can put a request in, and it's still a process. It's still a wait line to get there. It is possible. So that's a second reason. And then sometimes we get requests for something that may not be available in Canada yet.
Hmm.
Those are, I think, the three main reasons why we get calls. Can you think of anything else, Christy?
No, I think that's, yeah, those are the main things. You know, and a lot of times it's, you know, for instance, they may have had an MRI and they know that they need to have a surgery. but they're waiting, a year to 18 to the neurosurgeon, knowing that they need to have surgery. They just don't want to have to wait because they know once they see the neurosurgeon, then there'll be another wait to get on the list. So we see a lot of that too, where they haven't been to the specialist yet.
That's just amazing. Would you say then, just to paint a picture of a typical patient or a typical client who's opting for your services, are most of these folks older folks who are in pain because they're waiting for, say, hip surgery? Are they middle-aged folks who can't get proper care or speedy enough care for their children? Are they individuals that want to just get their surgery over with because it's causing them too much stress to sit there and have to worry and wait on a wait line? Is there a typical age range that try to seek out your services?
I kind of all over the board. I would say we tend to see people maybe like they're, we've had people call. We have had full of people contact us that they're children, but for the most part, it's an adult, and they're usually around, or older. The calls we orthopedics, and also GYN tend to be, the younger ones that we get tend to GYN, and then the orthopedics outside of spine, and then orthopedics is, maybe 50 and older, I would say.
So what you're describing here, as we know, our system is called universal health care, and we pay lots of taxes for it, and many Canadians are very proud of it. But what I'm hearing from you folks and from others who have had to opt to leave the country in order to find the care that they need, it sounds like there's a gap. There seems to be a gap in care between the fully funded universal system and actually becoming whole or well or better again. Are you noticing a gap? Is that what you guys are filling here?
We're certainly filling a need. And that's what we initially wanted to address when we started our business. If there is a need for it, and needs such as, what can we do for these people that don't know where to go? As far as universal care and the gap between whole healthcare system as a whole, there's definitely some sort of yes, I don't know if it's a need, like a broad need, countrywide need, but I think in general, a lot of people would like to have a choice. And that's another thing that we thought about. Well, if you're a Canadian, you're pretty much bound to one doctor, and that's very little choice to me.
If you can find one, if you can find a family doctor.
Exactly, yes. And it depends on which province you live in. Some provinces fare better than others. But, people who can't find family physicians, definitely a huge gap. But for our clients, it's sort of multifaceted view. Yes, there has to be a desire of not wanting to wait for some of them. Then there has to be a point in their decision making where they don't know what to do. They're stuck. So they're looking for solutions. And so it's sort of, it's hard to say, is there a need? We think there's a need, obviously, because we're starting this business. Is there a way to address it from the government? We don't know. But knowing how many people there are out there that don't know what to do, it sort of almost like breaks our hearts, right? Because we've been there. And it's an awful place to be because you're sick. You don't know what to do. What are your options, So offering them a choice, and some of them may not be able to do it due to different reasons. Some of them can't travel that far. Some of them may not be able to afford it. But, sometimes just even knowing that you do have a choice brings a peace of mind to these people,
So they'd feel less trapped, like they have some options around them if need be.
Right, if need be. And surprisingly, when it comes to people's health, people do find resources if it comes to the situation where they make this decision, I'm unwilling to live with this, and I'm going to find a way to deal with it. So it's very individual, like you can't kind of throw a blanket statement on it. So yeah.
Interesting. Now, of these folks that you help, do you find any of them, are they frustrated? Are they frustrated, that their taxes aren't covering this? Do they feel like they're waiting too long? Do they ever talk about things like that? Or are they just picking a different option going with you guys?
I don't know, Christy,
Yeah.
you want to? I think we do get to hear a little bit about it.
Yeah, by the time they call us, they're incredibly frustrated, for sure.
I can just imagine. And so for folks who are watching this, it's very interesting. I think the idea of having an option or having some choices, or even being aware that there are these wait times and that there are these lineups for what is generally considered pretty basic healthcare here in Canada, it's probably quite educational for folks. If they want to learn more about the services that you guys provide, where can they look?
Go ahead, Christy.
So we obviously have a website. It's www.healthvantis.ca. You can reach us through our phone number, which is 877-344-3544. And you can usually reach us, either way, or you can go to our email address, and that's just info@healthvantis.com.
And it's Vantis, Vantis, correct?
Yeah. Mm-hmm. Yes.
Wonderful. Is there anything I haven't asked you that you'd want to get out there for Canadians who are interested in this?
I would say that if you're stuck in a situation and you feel helpless, I would just never give up. Ask more questions, dig a little deeper, but don't agree to what you've been given first time. If somebody tells you the wait is 6 months, well, find out what are your options. At the very least, I would say, reach out to us. We don't charge for the first hour of consultation. We'll tell you your options, and that at least will provide you with some sort of, you don't feel trapped anymore. You do have options. That's what we want people to know. There are other options.
Excellent. Well, thank you both very much for your time. It's a very deeply appreciated for you joining us here on secondstreet.org.
Thank you so much.
Yes.
Thank you for having us.
Yes.
Take care. Bye-bye.
Yes.